Manipulation under anesthesia is a technique that's been around for many, many years. Over 80 years it is documented in the literature. MUA has specialized in treating chronic pain patients, the patients who have not responded well to traditional in-office therapy, conservative care, whether or not it was chiropractic, physical therapy, pain management, epidural injections, and so forth. When patients have gone through that gamut of care and they still have not responded, that's when MUA becomes appropriate. What makes MUA different than those techniques is it focuses upon scar tissue that has developed due to various reasons, such as disuse atrophy, such as injuries to ligaments, injuries to muscles and tendons. What makes MUA so successful is that you have a normal range of motion that is within your body. And that range of motion, for example, say it's this far. When you are conscious, that range of motion shortens down to about this far to give you a safety zone. And that's where apprehension comes in. And so if you take, say, for example, a person's arm and begin to turn it, at a certain point, they've reached that range of motion where they think to themselves, wow, maybe I shouldn't bring my arm any further. But under sedation, that response is no longer there, and there is a much deeper, safe, normal range of motion that we can bring that person through while they're under sedation. And so when somebody is highly trained to know what those ranges of motions are, we can get them to that very endpoint range of motion where all the scar tissue has developed from past injuries and from disuse injuries. Once a person has had an injury to a joint, the muscles become tight and in spasm around that joint in order to give support to the injured area. And so MUA now is really the only avenue for these people to safely and naturally and organically reach those tissues without surgery. And so once they are under sedation, we can now not only bring them to that range of motion that feels right to them when they're awake, but we can reach into a deeper, safe range of motion and now impact that scar tissue without them feeling any pain or any apprehension. And through your normal stretching and deep tissue massage that would be done in any office, but just at a deeper range, we can now impact those tissues to now free up the restricted ranges of motion that they had while they were awake. And that's why people get the most phenomenal and quick results with MUA.